Hello and good evening, everyone. Thank you so much for joining our third LIVERight webinar session of 2024. My name is Anisha, and I will be moderating and hosting this session. The Canadian Liver Foundation is located on the traditional territories of the Anishinaabe, Haudenosaunee, Mississauga, and Mississaugas of the Credit First Nation territories. We acknowledge and extend our gratitude and respect to all First Nations, Inuit, and Métis peoples for their valuable contributions. Non-Indigenous people have an important role as we work towards reconciliation, and the more action we take and speak up about solidarity with Indigenous people, the more we can create lasting change for future generations. So for those of you who may not be familiar with the Canadian Liver Foundation, the CLF was established in 1969 and was the first organization in the world created to help people with liver disease. The CLF is committed to promoting liver health and improving the prevention, diagnosis, and treatment of liver disease through our four core pillars of research, education, patient support, and advocacy. The CLF has rebranded our webinars to our new LIVERight brand, encompassing more of our support and education services. If you've attended any of our previous webinar sessions, you may remember that these were under our Living with Liver Disease brand. But even with our new name, our education services have been around for more than 25 years and continue to serve as a supportive educational tool for both patients and caregivers, as well as anyone else looking to learn more about liver health. The program provides an opportunity to increase community-based learning about liver disease and importance of liver health in hopes to reduce incidence and impact of liver disease throughout prevention, early diagnosis, treatment, and care without geographical barriers. Speakers included healthcare professionals, allied health professionals, subject matter experts, as well as patient advocates. Today's session will address information about navigating the healthcare system in Canada with a liver disease. We are joined by our speakers, Dr. William Wong and Dr. Sam Lee, and we also have a recorded contribution from Dr. Natasha Chandok, which we will have first, and then get into a live panel discussion with Dr. Wong and Dr. Lee, and wrap up with a Q&A. Please feel free to use the chat feature at the bottom of the screen to ask your questions during the presentation and panel discussion, but please note these will be answered after these talks. Before we get into the details of the session, I wanted to just do a quick poll with our audience today. This allows us to get feedback, share your knowledge and ideas, and a few brief poll questions will pop up on your screen in just a moment. These are really helpful for us in getting a better understanding of where your knowledge lies and where we can fill in some gaps. Please feel free to take a few moments just to fill out any of the questions. They are there in both English and French, and you are able to fill them out in the language that you prefer. While people are responding, I do just want to let everyone know that there will be a survey that will be sent out after the event, which may include some of these questions as well. And this is also just to gather further feedback and understand how we've done today. Today's session is also being recorded and will be available on the Canadian Liver Foundation's Resource Hub, on our website, as well as on some of our social media pages in the coming days. I'm just going to let everyone have a few more seconds here to respond. All right, I think we can end that poll here and get into the meat of today's webinar. So at this time, I would like to introduce our first speaker, Dr. Chandok, who has very kindly provided a recording of her talk today. Dr. Chandok is a hepatologist and gastroenterologist at William Osler Health System in Brampton, Ontario. She's also an adjunct clinical professor of medicine at McMaster University, deputy editor of the Canadian Liver Journal, and an active clinical teaching, is active in clinical teaching and research in liver diseases.
Uh, I don't know about others, but I can't hear.
I was muted. Let me just troubleshoot. You know what we can do while I figure out the settings on that? We will come back to Dr. Chandok's presentation towards the end of today's session. So I will introduce our next panelist for our live panel, and we will circle back to Dr. Chandok's presentation once I fix some of the settings on our sound system here. But I'll introduce Dr. Wong, and he is an associate professor at the School of Pharmacy at the University of Waterloo, recently appointed as Applied Public Health Chair by the Canadian Institutes of Research, the CIHR, and Public Health Agency of Canada, PHAC. He also is a member of the Ontario Health Technology Advisory Committee, OHTAC, for Ontario Health, where he served as a health economics expert for the province. The committee reviews health technology assessments and makes recommendations on what healthcare services and devices should be publicly funded. And Dr. Wong's research focuses on hepatitis B and C, health technology assessment, and cost effectiveness analysis. I'd also like to introduce Dr. Sam Lee, who is one of our medical advisory committee members. Dr. Sam Lee is a professor at the professor of medicine at the University of Calgary and a leading Canadian clinician scientist in the field of hepatology, who exemplifies what it means to be a multifaceted liver health champion. Sam was a volunteer member of the CLF National Board of Directors from 1997 to 2002, and during that time, carrying on today, he continues to support not only national initiatives of the CLF, but also the local liver health and patient support programs in Calgary. Welcome to you both. If you'd like to unmute, we can get started. So my first question tonight is for Dr. Lee. What specific blood tests would you recommend for someone looking to assess and monitor their liver health, especially for those concerned about liver disease?
Okay, well, the standard liver blood test panel is the so-called liver enzymes, which are GGT, ALT, AST, alkaline phosphatase, bilirubin, etc. And then depending on the situation, there are more specific blood tests that look for viral hepatitis markers of hepatitis A, B, and C. And then there's if you are worried about autoimmune liver diseases, there's a panel of immune blood test markers such as anti-nuclear antibody, anti-mitochondrial antibody, et cetera, that are common in or found in autoimmune liver diseases. And finally, there are what I call heavy metals, and it's not a bad type of rock music, but heavy metals. The liver is a storage site for a lot of things, including metals. And there's one super rare and one very common metal that is stored in the liver that can lead to significant liver and body disease. One is iron. That condition is called hemochromatosis, and that's the common one. In fact, in Northern European origin Caucasians, hemochromatosis may be the commonest, one of the commonest genetic diseases. In Ireland, it's said that 1 in 83 people have hemochromatosis. The super rare one is Wilson disease, which is caused by excess copper in the body. And there are blood tests, of course, for both iron overload and copper overload. So basically, those are the screening panel as well as the more specific panel of blood tests that can be done.
Okay, so if someone was going to their doctor potentially to ask about checking on their liver health, is there certain things that they should be asking to be able to receive those blood tests?
Yes, the doctor would run the standard liver enzymes and blood tests, and then depending on if it's just a general checkup with no symptoms or if the patient has some type of specific symptom or problem, then the doctor would order more of these specific panels that I just talked about.
Okay, that's great. Thank you. My next question is for Dr. Wong. Considering the increased risk of liver diseases in certain demographics, what targeted strategies should these groups adopt for early detection and management?
I think there is different liver disease, right, including viral hepatitis and then non-alcoholic fatty liver disease. So each one has their own characteristic, right, and then there is a different risk group, right, will be affected by the disease. So certain demographics, such as individuals with family history of liver disease, those with specific risks like obesity or excess alcohol consumptions, and certain ethnic groups who are coming from a higher prevalence of liver disease like hepatitis B area and as well as hepatitis C area may actually benefit from some targeting strategy for early detections and management. So I would suggest some strategy that those people affected or those group that is affected by the liver disease to do. The first thing, and it is the easiest thing, and it should be applied for every general population, including you and me as well, which is managing your lifestyle factor, right? Because that maintaining a healthy lifestyle habit that can reduce the risk of liver disease, right? Especially the alcoholic fatty liver disease. Okay? So we need to maintain a healthy weight, eating a balanced diet, fruits, vegetables, whole grains, and then limiting alcohol consumptions, avoid illicit drug use, and getting regular exercise. That will be the most traditional things that everyone should practice. And then we should go for, or the patients should go for regular health checkup, schedule some regular checkups to make sure that the healthcare provider is able to monitor the overall health, discuss any concerns with the healthcare provider, and then they can think of a particular interventions, right, when it is needed. And know your the third point is know your family history. So if you're aware that you have some parents or grandparents has some liver disease, okay, you should discuss this with your healthcare provider, right? Because there is some chance that you may actually inherit or infected by your parents or grandparents way in the past, right? So a proper test, just like Dr. Lee mentions, right, we'll able to find it out as well. And then another point it is educating yourself, right? Right now, we have technology is fast, right? And then internet, all the information is there. So feel free to take a look on different type of liver disease. It is all there, and those potential available treatment, it is all published online as well. So doing some educations, right, will definitely help yourself to understand liver disease. And then particularly for viral hepatitis B, right, we have vaccinations that is available. Make sure that your vaccination is up to date, right? If you are not sure whether I have vaccine before, right, then talk to your healthcare provider, right? They have a particular test that they can find out, right? And then they can do the catch-up vaccine if it is necessary. Some other point, if you are a illicit drug users, definitely you need to practice safe injection practice. So do not share needle with any other people. So obviously the best is avoid those activity. And then lastly, if you know that yourself has infected with viral hepatitis or any other liver disease, right, I would seek early treatment that is possible. There is definitely some important, right, as well as highly effective treatment that is available for treating viral hepatitis as well as some fatty liver disease as well. Yeah.
Absolutely. Those are great points. I think that, you know, it's really important to make sure that you're getting a comprehensive, you know, strategy for early detection and management. My next question, also for Dr. Wong, what are your recommendations for patients to foster open, stigma-free communication with healthcare providers about liver disease? I know, especially with viral hepatitis, that can be challenging.
Yeah, it is definitely is challenging. First of all, right, you need to choose a supportive healthcare provider. Look for a healthcare provider who is knowledgeable about liver disease. Sometimes it's challenging. A supportive provider can definitely creating a safe space for you to discuss your concerns without any fears as well as judgment. One thing that people need to keep in mind, right? There is definitely privacy law in place in Canada. If you don't want to let others people, right, including the one with your close relationship with you, right, for example, your spouse, to know about it, right? Then tell your healthcare provider about that, right? And they will, they are professionally trained up, right? They will treat this information confidentially. And then back to some of the points that I discussed in the question 2, right, which is educating yourself, right? So in order to foster open discussion, right, you need to know about the liver disease, right? Go to internet, right, and then find out what is the things that you are concerned, right? And then from when you're reading, right, generating the questions that you can ask, right, when the next time that you see your healthcare provider. Another point is be honest and open, right? So share your symptoms, right, concern, or even lifestyle habit openly with your healthcare provider. And very importantly is providing accurate information, right? Because sometimes we are concerned that, right, we don't want to disclose our past, right? But because liver disease may be actually catch up, right? Just one single thing in the past, right, that you may actually have liver viral hepatitis infected, right? So be honest, right, and then tell the truth. Be open to when you are talking to your healthcare provider, right? That will definitely help out this building a trust, right, between you as well as the healthcare provider. The next one, it is ask question, right? Obviously, you prepare that, right? So in order to have the communication, right, you set up all the questions in a one ask question, right? Don't hesitate to ask any questions about your conditions, right? Treatment options and any concern that you have. Okay, that will be help you to build again trust between healthcare provider and you. Lastly, it is the follow-up appointment. Okay, so if they set a appointment for you, right, make sure you actually go back, right, and see them. And because I do lots of population-based research, right, from the statistic, right, we found out there's lots of people, they don't go back to follow-up appointment, right, and then we will count them as loss of follow-up, right. Then make sure that, right, if this is the things that you are care about, make sure you go back, right, and then they will have the options, the best options that is decided for you. And then utilize technology. The last thing is there's some situations, right, you really don't feel comfortable when you go to the clinical place, right, and then talk to your specialist, right? So there is many specialists actually offer telemedicine, right? So they can do online consulting as well, right? So because right now, since we have COVID, right,
Yeah.
we already adapted to this virtual environment, right? So many people or many professionals is already adapting this type of technology, right? Since COVID. So some of the specialists, right, may have also have this technology things built in, okay? So you can utilize it if you really don't feel comfortable, right, about talking the specific issue, right, with your specialist, right? Maybe at home it will help you a little bit, right, throughout this process. Okay, so that's my point.
Thank you so much. I really think that was a very comprehensive answer, so I appreciate that. My next question is for Dr. Lee. How can patients discern and discuss the best or most up-to-date treatment options and screenings for liver conditions with their healthcare providers?
Okay, so I just want to elaborate a point that Dr. Wong just briefly mentioned in earlier, and that is the availability of online information. This is actually this is the first time in human history, dating back, how long have doctors and patients been around? Like 50,000, 100,000 years, huddled in the cave over the fire, and the witch doctor, the shaman, would treat your fever with whatever, dried goat blood or something. Anyway, it's the 21st century, and now we have Dr. Wiki and Dr. Google, and it's a fact of life. And it doesn't matter how good or how knowledgeable the doctor or the specialist is, many patients can avail themselves of fairly accurate medical information online if they know where to look. And Wikipedia, I've researched many medical topics on Wiki as well as Google. By and large, they are incredibly accurate. Sometimes it's written in a language that's not always very easy for lay people to get through, but you can find the information. So the patient can use these online sources and try to figure out what's going on. Obviously, the doctor, especially a specialist, is going to be the expert of last resort, and he or she can put into context the confusing array of online information. But it is the 21st century, and doctors who fail to or ignore this availability of online information, especially regarding treatment options, they're back in the dark ages. They're dinosaurs back in the 18th century or something. And the other point I want to make is that, and this pertains not just to this question, but to a few others, is that the thing we do worst by far is communicate. We're really good at diagnosing. We're good at maybe treating. Treatments have improved incredibly in many different fields of medicine, but doctors still we royally suck at imparting information in very clear, simple terms. And I still remember a couple of years ago, I was doing rounds in the hospital, and the senior resident, a very smart, knowledgeable young man, told the patient something I can't remember the exact wording, but it was something to the effect of, "Oh, it's okay. Your space-occupying lesion in the liver had all the acoustic shadowing characteristics that suggest a benign pathology, and your AFib did not complicate that issue at all." And the patient had a bewildered look on his face, and I could tell that the patient hadn't understood a single thing. And so doctors use way too much jargon. We use way too many abbreviations. You know why there's abbreviations in every field, but especially in medicine? We think and we tell ourselves, and you can think of your own fields, oh, it's to save time because you don't want to write 6 words out when you can just use the abbreviation. Well, that's only a small part of it. You know what the main reason is? It's to protect your territory. It's to keep the outsiders out. It's to make sure that no one invades our holy sanctum of knowledge and expertise that we guard jealously. So we use stupid, way too many abbreviations just to confuse everyone else. And my favorite story in that regard is there's a medical consultation request in a hospital, and there are like 6 abbreviations in the request. A patient with AMI and non-QT segment elevation with BOOP, B-O-O-P, and yada, yada. Please see about liver enzyme elevation. And the consultant, it wasn't me. I would have loved to have taken credit for this, but it wasn't me. Just wrote in big capital letters, Ikuya, I-C-U-Y-A, signed his name and then left. And the bewildered resident following the consultant said, oh, what? I don't understand. What does Ikuya mean? And Ikuya means, I can't understand your abbreviations. So this is a long-winded way of saying the patient has every right, and I must stress this, you have every right to demand that the doctor give you an explanation in simple, clear language. End of story. And stay there, sit there until you get the answer. And I've had so many situations where friends or relatives say they want a postmortem on the visit. Well, the doctor told me this. What does that really mean? And they pepper me with, like, because I'm a physician, they pepper me with 8 or 9 or 10 questions asking me to try to sort out what the doctor was trying to tell them in simple language. And I feel like, why didn't you ask them at the time you were there? And why are you bugging me? Can't read the doctor's mind. Yes, I can probably surmise what they're trying to tell. But why didn't you ask them at the time if you didn't understand? And most of them, they'll usually, oh, they're so busy, and I didn't want to take up the valuable time. God damn it, no. You have every right to take up their valuable time, okay? So demand an answer. Okay, have I answered that question in a sufficiently rambling rant?
For sure. No, I think that's great information for people to have. My next question is also for you, so you'll maybe be able to expand on that. But liver disease prevention and management obviously is very important. So what are key diagnostics that patients should prioritize, or maybe key things that they can do to help themselves? And how frequently should diagnostics be performed, or how frequently should they be perhaps following up with their doctor about these things?
Yeah, that's a pretty general question. It's not easy to answer, but I will say that in generalities, liver disease prevention and management, I think the simple panel, as I alluded to earlier, the blood test panel, is these so-called liver enzymes, and then more specific ones that according to the clinical situation, a specific liver enzyme or liver blood test panels, iron markers, the immune markers, viral hepatitis, etc. Now, beyond just blood testing, there are other simple tests that are widely available. Ultrasound of the abdomen and liver is usually found in even small towns and villages across the country. So ultrasound is a key measure, very non-invasive, no radiation, cheap, easily available, usually not a horrible, huge wait list for it. After ultrasound, then there are radiology and other imaging techniques. There is something called elastography, where a machine bounces a sound wave through the liver and measures how soft and how much recoil there is, how elastic it is. So that technique is called elastography. The trouble is elastography is only available in the large cities and some medium-sized cities. There are several types of elastography, but they're all fairly expensive. Now, there are much cheaper alternatives being developed, and these will probably be available in the next 1 or 2 or 3 years. So help is on the horizon. There's also certain specific blood test panels. For example, if you're suspecting fatty liver, then besides the regular blood tests, there's a blood test panel called a FIB4, FIB4, which is just 3 or 4 blood tests lumped together, and you put them in an equation, and it spits out a number that tells you if there's a risk of you having scar tissue in the liver. And of course, cirrhosis means just dense scarring in the liver. So FIB4 is a very cheap, easy, widely available blood test that is helpful in many chronic liver diseases.
Wonderful. My last question, and Dr. Lee, you did answer it in part, but I'll ask both of you to share your thoughts, and then we'll circle back to Dr. Chandok's contributions. What are the most impactful ways that patients can advocate for their health, especially when facing liver diseases, to make sure that they receive comprehensive care?
Okay, I will say this, beyond looking up, consulting Dr. Google, Dr. Wiki before the appointment, I always recommend, if possible, you come with somebody close to you, a friend or a family member, come to the patient appointment, because a lot of patients, especially if you've got a serious condition, you're worried about whatever, liver cancer or something, and they get the bad news, then they freeze up and they're like a deer in the headlights, and they can't remember anything of what transpired after that. That is an incredibly common scenario. Even if the diagnosis isn't something serious, they freeze up and they forget everything. So bring a friend or a family member who can help you and ask questions. And the third important thing I always recommend, have a little list. A lot of doctors who are busy hate this, but again, I go back to it is your right. It is your absolute right to have all your questions answered. Make a list of questions and don't leave till all of them get answered in a very clear, simple way.
Great, thank you so much. Dr. Wong, what would you like to add to that?
Yeah, I think totally cover the most important point, right? And know your ways, right? So familiar yourself with your way as a patient, right? Including the ways to, for example, get informed consents, privacy, access your medical record, right? So those are important things to advocate yourself, right? In terms of that is your patient's way as well. Stay engaged, right? As I mentioned, or Dr. Lee has already mentioned, right? You need to be active, right? And engage with appointment, follow-up appointments, and then monitor yourself as well, right? Because the healthcare provider will just see you a certain, maybe 10 minutes, 15 minutes, right? So you need to do your work, right? To provide the best accurate information for them as accurate as possible, right? And some of the point I already mentioned lastly in the last questions, right? Communications is a important thing, right? Educating yourself is also in important thing, and then as Dr. Lee mentioned, right? Ask question, right? That is the most powerful way, right, to allocate your health to your healthcare provider.
Absolutely. Thank you both so much. I will just flip back quickly out to Dr. Chandok, and I will try and make sure that this time we can actually hear it.
Hi, my name is Natasha Chandok.
Can everyone hear that? If someone wants to put in the chat.
Yes, we can
Perfect.
hear.
Thank you.
I'm a hepatologist and gastroenterologist at William Osler Health Center. Thank you for inviting me to speak on this LIVERight webinar. The first broader topic I wanted to discuss is equity and equality in healthcare. And I'd like to answer the following question: what can patients do to overcome disparities in healthcare access, particularly for advanced diagnostics like FibroScan in regions where they are not available? So the first point I want to make is it is important to discuss your concerns and questions with your primary care provider. Obviously, should you mutually have concerns or want your disease to be assessed further, it is very reasonable and appropriate to request a referral to a hepatologist. Education in your own medical condition is vital, and it may be useful to visit reliable online resources to learn more about your condition or to see what resources may be available within your community. For example, one can visit websites like the Canadian Liver Foundation or healthcare organizations such as the Mayo Clinic or the World Health Organization to gain more understanding of the condition, as well as some of the diagnostics, which may or may not be required for all patients. In those Canadians who live in rural areas, it would also be useful to understand what virtual care options may be available and what alternatives are available to specialized tests. For example, in the case of a FibroScan may not necessarily be required for all patients with fatty liver disease, and non-invasive blood tests or certain calculations we do on blood tests may provide almost similar information to a FibroScan. So that would be an example where there may be alternatives to specialized tests. And in those Canadians who may live in more remote areas, that may be useful to take advantage of. Advocacy is very important in hepatology, and it's needed from all players, be it physicians, other healthcare providers, patients, and the general public, to improve Canadians' access to liver clinics that offer hepatology care. And finally, it's important to discuss any healthcare access or equity issues that you may feel with your local government representative. The next question I want to address is the following. If a GP diagnoses a condition like fatty liver, but does not refer to a specialist, how can a patient effectively advocate for a referral? So one of the most important qualities to have with your primary care provider is an open and honest communication, and you as a patient feeling comfortable to bring up any concerns or questions with your provider. So I think everything starts with a conversation about your condition, reviewing the tests that you had, and discussing whether a primary care provider should make a referral. In the event that your primary care provider does not make a referral, that may not be an unreasonable decision. And I think a patient should invite them to elaborate on their decision. As you may know, I'll give you an example of fatty liver disease. Fatty liver disease affects about 1 in 4 to 1 in 5 adult Canadians. And likely not all patients in Canada can see a specialist by virtue of that large number. And there are very reasonable times where your family provider may be able to assess you as a patient and really stratify you. And if they feel you're a low-risk patient, I think having a conversation with them, making sure all your questions are addressed, may be very, very useful. Education is very important in our health. It helps us to understand what's happening, helps us to work on healthcare goals and adopt preventative strategies to improve outlook. So I would encourage all patients to find reliable resources to educate themselves. Examples of reliable sites that I would often direct my patients to may include the Canadian Liver Foundation, university-based hepatology websites like the Mayo Clinic or the University of Alberta, World Health Organization, the American Association for the Study of Liver Disease, and the European Association for the Study of Liver. If you are concerned, you of course should always discuss that with your provider, and you can always request an opinion from a hepatologist. The next question I want to address is, how can patients navigate varying medical opinions and ensure that their treatment plan aligns with the latest practices for liver health? So, just to reiterate, it is important to have an open dialogue and communication with your healthcare provider, be it your primary care practitioner or your specialist. You can certainly ask to see a specialist in liver disease if you have questions or concerns which you feel are not being addressed, or if you have risk factors for advanced liver disease, such as a family history. Self-education on your condition is very important. I would encourage any patient to write down their questions before their appointment and consider bringing a family member to support you during your visit to make sure that advocacy is being done, to make sure that your questions are being addressed. You can always ask your provider to give you guidance on additional educational resources if you need. It is important that all of us advocate for liver health care in others if we can, and there are many ways to advocate. We can visit institutions like the Canadian Liver Foundation or other reliable organizations to learn more. Thank you for allowing me to participate in this important webinar.
Thank you very much to all of our speakers today. I know we're doing things a little bit backwards, so I'm just going to pop through these, but we are now live. So if there are any questions that we have from the audience attending today that you would like answered, please feel free to share them in the chat. I will stop sharing for a moment. And then if there are any questions that we have here, we can answer them now, but I know that we have also had a few that came in before the session that we can start with. So my first question, I'm going to ask probably to Dr. Lee. Can you offer any advice on how patients can maintain an effective partnership with their healthcare providers to ensure that their liver conditions are actively managed?
Yeah, I sound like a broken DVD, but again, and I was happy to hear Dr. Chandok basically said a couple of the exact same things I did about bring a friend and write your questions down. So I think maintaining lines of effective communication with your healthcare provider is the key. And again, asserting your rights as a patient to have clear, open lines of communication in simple language, and don't feel that you're impinging on the almighty great doctor's time, and what the hell, go in there with the list and assert your rights as a patient. You don't have to be nasty and aggressive about it, but just yeah, keep open dialogue, I think, is the key. And I do want to clarify, even though I said docs hate the patients show up with that list of questions. No, not if they show up with 5 or 6 or 7 questions. The ones I hate are the patients show up with like 15 questions, and some of them don't even pertain. When's the next total solar eclipse in Canada? But no, just a simple short list of pertinent questions, not 25 of them.
Yeah, I do see from one of our participants today, they have a NAFL diagnosis, non-alcoholic fatty liver. They've had radiation done now, F2 to F3 with cirrhosis, but their gastrointestinal doctor won't let them ask questions. Do you have any recommendations for doctors that or for patients with doctors that maybe aren't as open to hearing questions from them?
What do you mean they won't let them ask questions? What kind of that's very wrong of the doctor. If you're, find another doctor is what I'd say, or if you can't, just say, look, I have a right to have my questions answered. That's all. You don't have to be nasty, but that's the trouble. Okay, don't get me started on this, but it's this thing about communication and fee-for-service medicine. You want to crank through as many patients as possible. It's not the right way to practice. Okay, I'll stop before I get sued.
No problem. My next question for Dr. Wong. Obviously, navigating the healthcare system can be quite daunting. What are some of the key strategies for patients to make sure that they're engaging with the right specialists for their liver condition?
Yeah, it is always challenging, right, to find the right specialist, right? But again, it is all the similar point, right? So when you are going through this system, right, talk to your primary healthcare, right? Because this is your first point that going into the healthcare, okay? So the communications with them is important, okay? And then if you have any particular liver conditions or condition situation, right? So be sure that you also communicating with your primary care provider, right? If there is any things that you didn't like the specialist, or you want to hear about a second opinion, right? Because sometimes there are some situations that second opinion is also important, right? Then communicating with your primary care provider, right, to get a secondary opinion, right? That will be another way to make sure that your concern, right, it is actually addressed, right? And then if it is really necessary, right, then ask them, right, is there any other specialist that is available, right? Then they may actually refer to you to another one, right? If there is really some trouble, right, with a particular healthcare professional or specialist. Okay.
Absolutely. I think this will probably be one of our last questions for tonight, but for those diagnosed with stage 3 liver disease, what are some of the essential monitoring practices and maybe some of the thresholds for seeking more advanced medical interventions, where they should maybe be pushing their doctor for a little bit more help in some ways? Maybe Dr. Lee, you can take this one.
Stage 3 means stage 4 is cirrhosis. So stage 3 means a lot of scar tissue, but not yet cirrhosis. So I would think for sure a fibroscan or some kind of equivalent elastography. There's something called shear wave or other types of elastography that are usually available in medium and large size cities. So that kind of thing would be useful to monitor, as well as a regular visit with the healthcare, the family doc, as well as the specialist should probably see you periodically to determine if your liver disease is progressing.
Absolutely. Thank you. One last question actually from the chat here. And maybe I'm not sure if either of you want to take this, but what tests can be done to find out about what level your portal hypertension is at, if there are tests to do that?
Yeah, I think elastography, either FibroScan or the other types, shear wave elastography are reasonable, as well as a simple blood test like looking at the FIB4 and the platelet count, and an ultrasound would give you an index of how much portal hypertension. It not necessarily super accurate, but there is a super accurate way, but that involves sticking a catheter down your jugular vein. I don't think
goodness.
people want to have that, but the ultrasound, elastography, and blood test panel would be a pretty reasonable way.
Wonderful. All right, so that concludes our session Q&A for today. I did want to let people know that coming up, we do have our LIVERight forums in Ottawa, Calgary, and Vancouver. These are going to be hosted in Calgary and Ottawa this coming Saturday, and they will also be in Vancouver on May 11th. So if you'd like to register, if you're in any of those areas, you can feel free to do that at liver.ca/forum24. I'd like to really thank our speakers again for taking their time, for their generous contributions. As I mentioned earlier, this session is being recorded, so it will be on the CLF webpage, on our resource hub, and on our various channels over the next few days. Additionally, keep an eye out for our next webinar session and our sessions throughout the year. So our next session will be on May 15th, and it's in collaboration with UHN, and that will focus on finding a living liver donor. So more information on these sessions will be available at the start of each month. So if you don't see anything posted yet, or there's minimal information, feel free to check back again soon, as we're likely finalizing some of those details. I do want to mention as well that there will be a post-session survey at the end of the session that will be emailed out to registrants. Please complete it if you can. It helps us improve our services over the next coming months. So I wanted to thank everyone again for attending today's session. And you can feel free to stay connected with us. And if you have any questions, you can always contact me directly. Thank you all once again, and have a wonderful.
Thank you. Bye.
Thank you, everybody.